Hello and welcome to Behind the Spires. I'm Ed, and this is...
Hi guys, it's Molly, and we are your friendly city government employees.
Yes, come join us behind the Spires, where we will bring the business of Frederick forward, highlighting updates on Frederick's projects, policies, and events.
Each week, we bring a special guest with us behind the Spires, and with October being Breast Cancer Awareness Month, today we're diving into an important conversation about prevention, screening, and early detection.
Yes.
Joining us is Jodee Rudy, a nurse with the Frederick County Health Department's Breast and Cervical Cancer Screening Program.
Wonderful.
Yes.
If you're not watching us on video, though, you can catch our lovely mugs on YouTube at City of Frederick, Maryland. Of course, you can also listen to us on Spotify, Apple Podcasts, Amazon, and then all the other podcasting services.
And before we dive into the episode, a quick announcement.
Announcement?
The general election is coming up fast.
Gasp.
Yes, ballots are already out in the mail. If you're voting by mail, remember your ballot must be postmarked by November 4th and received by November 7th.
Yes, and if you prefer to vote early, in-person voting is October 24th and 25th from 10 a.m. to 8 p.m. at the Trinity Recreation Center, 6040 New Design Road.
And of course, Election Day is Tuesday, November 4th from 7 a.m. to 8 p.m. at Trinity Recreation Center, again at 6040 New Design Road.
You can also return your ballot at one of 6 official Dropbox locations around the city. Just remember, Dropbox ballots must be deposited by 8 p.m. on November 4th.
Yes, and you guys stay informed. Visit frederickmd.gov/elections for all the details.
All the deets.
And we will be right back. Can't with you.
We really value the partnerships we create with local companies who we trust to provide products and services that help us keep Frederick at the highest level of livability and sustainability for our residents. Just visit our website at frederickmd.gov/Frederick Buys and follow the prompts to register as a vendor today. Remember, when Frederick buys, Frederick thrives.
Thanks, Lance. Oh, by the way, welcome back.
Welcome back. Thanks, Lance. And we are here with quite possibly the coolest name and person we've had so far on the podcast.
Yes.
Jodee Rudy, welcome to Behind the Spires.
Thank you.
And to kick things off a little bit, tell us about your background as a nurse and what drew you into cancer prevention.
So I've been a nurse for a long time. I started out, got a degree in psychology and didn't know what to do with it. So then I became a nurse at University of Maryland. And I was a pediatric nurse initially. And then I got tired of the commute from Frederick. And so there was a job here at the health department in the women's health clinic, and I jumped on it. And I didn't even realize that I would just love public health. And so, working in the hospital is very stressful. Yes. And you don't get to do what I like to do in the hospital as much. I really like talking to people, educating people, and working with them. And it feels like, you just have so much medically to do with them. And so when I came to the health department, we educated women and did pap smears, breast. And that's where I sort of got my first interest in breast and cervical cancer program, because we did screen women there too for it if they were of age. And so anyway, I've been there for like 30 years, worked in all the different kinds of departments, and now I've kind of found myself in the breast and cervical cancer program, which also we have the colorectal cancer, we have some diabetes education in this division that I work in, and I really like doing that.
So that's a big testament to the Frederick County Health Department that you've been there for 30 years.
I know.
When you said that, I was like, no way. That's awesome.
Yeah.
What does your typical day or your routine and everything look like for the breast and cervical cancer screening program?
Well, mostly what I do or the nurses do in the program is we work with the clients to get appointments so that they can get their breast exams and then their pap smears. And then once they have those appointments, then they get a mammogram referral, and then we help them set up the mammograms and then follow them up with any abnormals. But a lot of what we're doing is case management. And so, we're connecting them to resources as well. But basically just working with them for normals and abnormal results.
And so for those who aren't familiar, first of all, it's October, so Breast Cancer Awareness Month.
Right.
And you are wearing the beautiful pink scarf for it. Yes, and pink shirt, double pink. So for
Pink.
Oh,
yeah,
Ed is also
A
wearing
little
pink.
peach, but
Oh my gosh, I forgot. I'm wearing green. Okay. So for those who aren't familiar, what is the breast and cervical cancer screening program, and why is it so important for our community?
So the breast and cervical cancer program's been around since 1991, the grant that we get, and we get that from the CDC. And basically what it does, it allows people that are women, and specifically, and you have to be 40 and over to be in the program, and you have to meet a certain income, and you have to meet a certain live in Frederick County.
Okay.
So those are some of the criteria for the program. And then when you're in the program, we offer the breast exam, pap smear, and mammograms.
Okay.
now your website says the program provides clinical breast exams and mammograms and it tests at no cost.
Right.
Can you walk us through how that particular process works?
So we get referrals from providers. You can self-refer if you were on our website and saw information, and we have a lot of great programs on our website. You could call us. You go on the website, and I think there's a link in there and put some information. We would call you back, but we would get some demographic information if we talk to you, basically find out and confirm that you live in Frederick County and that you meet a certain income. So we literally, most of our clients are low income and they're uninsured or underinsured, so that their out-of-pocket costs a lot. And so maybe it's a barrier to getting these kind of screenings.
Okay. And if if people are interested, they can go to the website, and is that information up there,
Yep.
like the thresholds for the different low income and underinsured?
Yep.
Okay.
There's all the information out there. And then if they, sometimes, people are hesitant or they're scared to do some of these, or they don't understand. So a lot of people times will call us and just talk to us about, what exactly these kind of screenings are.
And do you like that part because
Yes.
you like educating people?
Yes. Yeah. Or I just, talk to people that, some might say I don't want to get the mammogram because of the radiation, that'll kill me.
Yeah.
And I'm like, no, that's misinformation.
Yeah.
So the mammogram's really low dose of radiation and is recommended for all women,
Yeah.
ages 40. So the CDC wouldn't recommend it for all women if it wasn't safe.
And we were talking about it before we started, and I guess I'm telling my age now, but I just had my mammogram.
Yay!
And you're like, woohoo!
Okay.
And thanks, Ed. And it's not scary at all.
Oh.
That's the thing. I feel like there's so much like build up, but once you get there, and I kind of was like, oh, okay.
Did
That's
you
it?
feel it was like a rite of passage?
Yeah, I did actually. I was like, I'm a real woman now. So yeah, if anyone is like nervous about it, go get it.
Yeah.
Right?
Yep, exactly.
So you talked a little bit about like the diagnosis, but the program also covers some treatment services, or
Right. So if people come through our program and say they're diagnosed or they need further testing, we have Maryland has the Diagnosis and Treatment Fund, and so we would help them apply.
Okay.
It's not an easy application, and so most times we'll have people come in and help them through it. And if they've been diagnosed with cancer, then as a nurse, we have to put in their plan of care, put in their staging, and all kinds of information for the diagnosis and treatment. But they're very particular. You definitely have to be a resident of Frederick or Maryland, and you have to meet their income guidelines. And they ask for a lot more than we do. So sometimes it can be difficult.
And you help everyone walk through that
Yep,
application
yep.
process.
If they need divorce papers or whatever, they have to supply that. They can't just say that they're, single or whatever, or,
Right.
separated. So they have to have all that information for the diagnosis and treatment program.
Okay, awesome.
Yep.
So you really are case managers there.
Yeah, I feel like we define case management because we work with people that don't necessarily prioritize what we are offering.
Right.
So, people that are low income or have, very little income, their priorities are putting food on the table, getting
Right.
to work, getting the kids to school, those kinds of things, not screening. They might be more interested in getting their kids immunized or things like that than working, doing things for themselves.
Yes. Oh, that must be so fulfilling.
Yeah.
Because it is. You're like helping people, stay safe. And it's such an important thing to do. But it is so low on the priority if you have other things
Yeah,
to worry
it's
about.
easy to push off.
Yeah.
It's also if you haven't been going to a doctor regularly, you may not know that this is a screening that's recommended.
Right.
So that's another thing. A lot of our clients have not really been to primary care, so we hook them into a primary care. I mean, we were just talking about the Community Action Agency or Mission of Mercy,
Yes.
just to get them in so that they can have their maybe yearly screenings, just health screenings with them.
Fantastic.
Yeah.
So like connecting them with all those resources. Shout out to the Community Action Agency. We just had Kimither on.
Yes.
That's awesome.
Now, you mentioned some of the things that sound kind of like barriers. This would be kind of low on the totem pole and everything, but, you have some more important things up there. How do you address some of those barriers so that you can make the program more accessible to people? And if there's any other barriers that you might know of, maybe let us know.
So part of our program, we have a really robust outreach program. And so we know that there are barriers there. So we're out in the community a lot. So any type of health fair that's going on, we're typically there. If you hear of groups, we end up, going anywhere we need to go. We had a cute little older lady that asked to come to her church, and we would go to the church and talk to anybody in the congregation about our programs, because it's not just about people that don't have health insurance. It's just educating the community so that they can get mammograms too and protect their loved ones.
Yeah.
Yeah.
So anyone can reach out to you and like ask you to come in terms of like public health education.
Yeah, we have an outreach calendar. We put it on there. Yeah.
That's cool.
Yep.
Is there anything you guys don't do? You're listing all of these things. So what about like barriers like transportation and those kind of resources in the community? Do you hook people up with that?
Yeah, I mean, we used to offer vouchers for the bus, but now it's free.
Right.
But we do still see transportation as an issue, but not quite as much. I think the biggest barrier is, you have women that have children, they're early 40s, they've got kids, they work, and how do they get time? So that taking off in the middle of the day, because you don't get your mammograms after 5 o'clock, and you get them on Saturday and Sunday. So it's hard to do that. I think that's the barrier. The barriers of anxiety about the whole thing. What if they find something?
Right.
I don't. If I don't get it tested, I don't have it.
Yeah. Right. That's relatable though. Like if I don't know about it, it's not there.
Yeah, if I don't feel anything, I'm fine.
Right.
Yeah.
But you and I were talking briefly before too about just how far everything has come in terms of early prevention, screening, treatment. Like the diagnosis is not the same as it was.
No, back in the 90s,
Right.
80s and 90s, women were just dying of breast cancer. Now, if we can get them in early, get them diagnosed early in treatment, then the prognosis is better and the lower mortality rate.
Yes.
So, yeah.
Yeah, we were talking before. My mom passed away in 1990 from breast cancer. And so just the idea of that word, I was like, I don't want to think about it. You know what I mean? But now it is so.
And the genetic testing we were talking about, the fact that you even can do that is just crazy.
Right, and that there is a gene.
Yeah.
Like we didn't even know any of that back then. And now we know so much.
Yeah.
So it is really hopeful. It's not, I feel like it's not as anxiety ridden.
Right.
Yeah.
Now, roughly about how many women do you serve each year through this program?
We have somewhere between 800 and 900 that
Whoa.
we see, and some of those ladies are in Montgomery County as well. So we have we help Montgomery County women to go get mammograms as well.
How do you do that then?
So some of that's fairly new.
Okay.
And I don't know if it's been a year or two now that we've been doing that, but we have an outreach worker and that helps pull in some of those clients in the Montgomery County area. Now they're seen there. Like we're just literally on the phone. It's just so nice now that you can do things on the phone or virtually kind of things. So they don't have to come to Frederick County.
Right.
So we have providers in Montgomery County as well.
Jodee's like, I've been at the health center for 30 years. So like having all the digital tools was not.
Oh my gosh.
Yes.
It's so amazing. Like we used to have a hard time to get a hold of our clients, and now being able to text and call them.
Right.
You know, texting is just amazing. Like I can remind them. I don't have to worry about actually physically talking to them.
Oh yeah. In terms of like facilitating them getting to appointments or reminding them.
It's been a lifesaver.
Oh, fantastic. Can you share like a memorable success story from the program, or when it, either the program or you really made a difference in someone's life?
So I was thinking about that. I think that, I don't mean to sound like cop out, but just like every client that we get through the program is a success story.
Oh.
So we're decreasing their rates, potential risks for, breast cancer. I think that as a case manager in the program, I think I get really excited when I've had a really hard client where maybe they don't read and write, maybe they don't have any support system, maybe you just have all these little maybe they're homeless, so I don't have a phone. So how do we get a hold of them? So those kinds of things we really work towards helping them. And then I think too, like we help connect them. So if we've got a client that is like dealing with abusive situation, we're going to refer them to the Hartley House. We're going to connect people if they're having mental health issues, so that we can get through to the breast stuff.
Yeah.
So I really like that. I like that holistic sort of approach that we do at the health department. I guess one of the most memorable some of the most memorable cases is when you get them in. And sometimes they haven't been going to doctors, right? And so when they come in, we ask them a few questions, and then they go to their clinician, and the clinician's going to do a head-to-toe sort of assessment, and they find other things. So we had a client where we've had over the years a couple of clients where they came in and they didn't have cervical cancer and they didn't have breast cancer, but we found uterine cancer. So then we connected them to the Maryland Cancer Fund, and then we were able to get her on clients on Medicare, just different things. So. But the reading and writing threw me for a little bit initially. There's times where I have cut and pasted pictures to get appointment times and clocks and stuff for them, just to try to make them feel empowered so they don't have to have somebody else help them. But yeah.
I love that. You guys are doing really awesome work.
Absolutely.
Do you work with the Frederick Literacy Council?
Not per se,
Okay.
but we do, if no, not really. I haven't really ever referred to the Literary Council, but we definitely have had clients over the years that have that problem.
Yeah.
So I don't know. It's just neat to
Yeah.
help people.
Yeah.
And then, or work with a mom, and then later her daughter comes through the program. Those are kind of neat moments too.
Oh my gosh. I love that.
Speaking of something like that, from your perspective, how has this program changed cancer outcomes in Frederick as a whole, city and county?
Yeah.
I think that was a hard question that I was trying to contemplate about. I think the early detection, is really what the focus is, and that's how it's changed. It's changed over time in that there's less women just dying of breast cancer, and it's getting people in and getting them screened. So, and people, there's more of an awareness, I think, for mammograms, but there still are people out there that don't understand what they are, or the radiation, or the, conspiracy theories kind of things going on that you have to talk to them through. So, and sometimes there's little barriers that we find that for example, they may not want a male technician doing the mammogram or to see them. I mean, so they don't know that they can ask for a female. So those are things that we can work with them about.
And I find that there's some like really good public education campaigns that don't necessarily like lighten it, but they make the education a little more accessible, like in terms of just like, hey, screen yourself. And this is like, it's not so scary. Like they'll do like, I think it's like something lemons or something like that. They have like a very catchy education campaign where it just provides more awareness to people that it's like, hey, this is something you can get and it's not scary at all. And it's good for you.
Yeah. I mean, when I first sort of got in the program, we had these door hangers that showed like you how to do your own breast exam.
Yeah.
And so over the time, it really hasn't. It's not that we don't recommend it, but we just want to recommend more that you go to a clinician that has the expertise of feeling a breast and knowing what something abnormal feels like. And so, but, and we used to have these little fans that we gave out to, try to get, with our information on it. So over the years, we have little tchotchkes that we give out to outreach to get people to know about us.
I love that. And now you have a podcast episode about awareness.
Yeah.
So what goals do you guys have for the program over the next couple years?
Well, of course, we want to secure funding. We never know, so always want to secure it or increase it.
Yeah.
And if we increase it, we want to expand not only the numbers of screenings, but also like getting out there in the community more. And reaching people.
So final plug for someone who's hesitant about screening. What is the message, the one message you want them to hear?
That you're not alone, that there are other people feeling the same way, and that just call us and we'll talk to you guys, answer any questions you might have to make you feel better. I think there's, everybody has different concerns about the issues, and so... and they may not know their own family history, and so they don't know their risks and stuff. So I just feel like, just talking, would be the thing if you are hesitant.
I love that. That's perfect.
Now, how can residents support this program and help spread the word?
So I'm sort of old school. I think word of mouth is the best way to tell. So if people are listening to this podcast, is just talk to other people about your mammograms. I mean, I have a very close friend that she's just like, I am working on her every day to get her mammogram because she does not want to do it. She says it's going to hurt. And I said, it's not going to hurt. So,
it doesn't hurt.
Yeah, it doesn't. I mean, there is a little bit of pressure just to, they take 2 plates and they're taking pictures. So they hold your breast in a place and then they have to run around the corner and take a picture.
Yeah.
So it's not like it's forever and it's not painful, agonizing pain. And also modesty can be an issue too. So like I said, asking for a woman, but they're very good about that. When you get yours, they're not like having it all, you're not all hanging out. And, they cover up one and they do it. It's very like,
and business. And the woman who helped me was the nicest person in the world. Like she was so sweet and she was like, and this is uncomfortable, but here we go. And I would akin it to getting an x-ray anywhere. Like you have to hold in a certain place. Like when you get an arm x-rayed, you have to hold it awkwardly, and then it's over. Yeah. Or like this is not a good thing to compare it to, but the dentist, when you get like some, an x-ray, and you have to like hold that thing.
Oh, yeah.
It's actually the dentist is worse. Yeah. So this is nothing like the dentist.
That's funny.
Yeah. Well, Jodee, thank you so much for telling us all about the program. We're definitely going to put the website up so people can learn more.
Oh, good.
And make sure if you know anyone who might have, fit the threshold for being a client of the Frederick County Health Department, let them know. Yeah. And also spread the word. It's October.
Now, did I mention that about Team Hope, or will we talk about that?
No. Can you mention it now?
Oh, yeah.
What is Team Hope?
So I wanted to mention that too, because we screen women at 40 and older. And so sometimes you may have a younger person that has a higher risk for breast cancer. And so Team Hope is a local nonprofit that will help women younger than 40 to get mammograms. So they are amazing. And so we are very lucky to have them. We also have them for those women that don't meet our income criteria, but yet don't have insurance. So they can actually go to Team Hope as well.
Fantastic. So they bridge the gap with younger patients or who don't necessarily fit the exact criteria. and it's Team Hope. We got to
Yes.
put them up as well.
Yep.
Thank you, Team Hope.
Thank you.
We have a lot of incredible people in this community. I think it's so
gosh,
special. And so thank you for helping raise awareness and providing education. And before you go, we do have something that's called
Quick round trivia.
Quick Round Trivia. Okay. We also have hot sauce. Jody's like, I'm not doing that. Ed
So-
brings hot sauce, and I'm here to say you don't have to do it. But if you want it, you can do it.
So this is not a very hot sauce. It's just McCutcheon's hot sauce. It's Vidalia onion. Or
Oh, Vidalia onion. Vidalia onion is my dad's
Yes.
favorite.
And I have a spoon. If you'd like to try, the way this works, you just pour yourself a little bit, and then once you take a little sip, we'll start asking questions.
You can also say no,
You can also say,
and we'll just ask the questions.
I'll try it.
Yeah, I'll open it, but
McCutcheon's is awesome.
yes.
Not a sponsor yet.
I can't believe that. So when I was for a couple years in high school, I went away to a boarding school in Pennsylvania, and I was so excited when I went to the mall and they had McCutcheon's jelly in the middle of the mall.
Really?
You were like, I'm in my place.
So I'm just gonna taste this, and then you can ask me
Yep.
questions.
Yeah. And if you need the water, we have it. Okay. Jodee, the pink ribbon, true or false? You've already answered this question before the podcast. The pink ribbon became the official symbol for breast cancer awareness in the 1990s.
Yes.
Do you know the exact year?
And I could make a guess.
Yeah.
1991.
Okay, close.
very close.
92.
What fruit is often used as a reminder for breast self-exams because of its similar texture?
Oh wait, don't say that part. Just pick the fruit.
A fruit.
Yes.
An orange? I don't know.
Yes. Orange or lemon we would have taken.
I was gonna say the apple would be too hard.
Yeah. Okay. What's one small but powerful step anyone can take for their health? This is an open-ended question.
Step for their health.
Yes.
The first step, I guess, talking to people and making an appointment.
Yeah, schedule a checkup. That's number one. Drink more water. Remember to, guys, schedule your appointments. We'll put up the website for the Frederick County Health up on the screen. So if you want to know more information, you can check that out. And Jodee, thank you so much for being with us today. We really appreciate all the work you do in the community and all you're doing to help women take control of their health and make sure they're healthy and they're here around for their families. So we appreciate it.
Thank you. It was fun, actually. I thought it was going to be horrible.
We got a great plug from Jodee. And we will be right back.
Registering for City Alerts is a great way to keep you safe if you live, work, or play and visit in the city. COF Alerts is the official City of Frederick emergency alert system that is designed to alert, warn, and notify residents and businesses of emergency situations. We use Frederick County government's Everbridge alert system to provide this critical service. You pick how we can reach you. You can receive alerts via text, email, and push notifications from Everbridge. COF alerts may be sent for emergency situations such as snow emergency declarations, police and security alerts, major water system issues, and hazardous weather. You may also sign up for automated weather alerts from the National Weather Service, such as watches and warnings for tornadoes, winter storms, and flash flooding. Remember, stay safe by staying informed.
And welcome back.
Welcome back, you guys. Before we wrap up today's episode, we want to share something special happening right here in our community.
Absolutely.
The Harvest of Hope Festival is coming up on Wednesday, November 19th from 11 a.m. to 4 p.m. at the Harry Grove Stadium parking lot. It's hosted by the City of Frederick in partnership with the Spanish-speaking community of Maryland, and it's all about bringing people together, celebrating the spirit of generosity, connection, and hope as we lead into the holiday season.
Yes, I was in attendance last year. It was a lot of fun.
It was
It
great.
was very packed. They ran out of turkeys.
Yeah.
Like, it was
It was
really
an
nice
awesome event. Yes.
This free family event will feature turkey giveaways, for Frederick County residents, plus community resources, music. I was the DJ last year.
Ooh.
Raffles, and local vendors. It's one of those days that truly captures what Frederick is all about. Neighbors supporting neighbors and building bridges across our community.
Yes. So everyone, if you'd like to volunteer, become a vendor, or just learn more about this awesome event, visit frederickmd.gov/Harvest of Hope for all the details. I will say as a plug, DJ Lazy River, I believe, is going to join.
He may be in attendance.
And there's going to be a second DJ who we're calling DJ
Harvey Hope.
Okay.
I wonder where that comes from.
The way we said it at the same time. So you guys have to come check it out.
Yes.
We hope to see you there.
And before we go, here's another way that you can make a difference this season. The City of Frederick is proud to serve as a collection site for the Asbury United Methodist Church Coat and Hygiene Drive. You'll find a donation bin in the City Hall lobby through December 5th.
Yes, this marks the 4th annual Community Coat Drive, supporting incredible local partners like Helping Hands and Caring Hearts, Children of Incarcerated Parents Partnership, Andrea's House, Lincoln Elementary, and the Lucy Center, Steadfast Beyond Shelter, On Our Own of Frederick County, and Water Boys for Jesus Christmas Alive Project, which provides Christmas for over 225 local families.
You can stop by City Hall and drop off new winter coats or hygiene items for people of all ages. Every single donation helps keep our neighbors warm, and that's what community is all about.
Yes, so 2 awesome events, Harvest of Hope and the Community Coat Drive. Come to City Hall, drop off your coat, your hygiene products, new winter coat.
Right.
All ages, all genders, no matter what, drop it off.
Yes, maybe not get them confused. Don't drop off a frozen turkey.
No, don't give us a frozen turkey and then bring a coat to the Harvest of Hope. Come to the Harvest of Hope.
I mean, you might want to bring a coat.
For the good vibes. Yeah, it might be chilly. For the good vibes and the turkeys.
Yes.
And DJ Lazy River and DJ Harvey Hope.
Yes, and to kind of bring things back around, you know what? We want to hear from you.
We do want to hear from you.
Please email us at behindthespires@cityoffrederickmd.gov.
That's Behind the Spires at cityoffrederickmd.gov.
I hear it's Behind the Spires at cityoffrederickmd.gov.
Yes.
To let us know what you want to hear, what questions you have, who you'd like us to interview.
Remember to like and subscribe to us on Spotify, Apple, Amazon, and YouTube. And before we dip behind the spires, we ask just a teeny tiny little favor. Tell all your friends about your time here. And if you get a chance, please give us a simple 5-star review. You can even do that right in your podcast app. Your support will help us grow, and we really appreciate it.
Yes, and thank you for hanging out behind the spires. And remember, kindness costs us nothing, but it means everything.
Bye, guys.